Hello and welcome to my channel. In this video, we will discuss about how homeopathy is useful in pregnancy and childbirth. So basically in this video, we will discuss about pregnancy and childbirth made easier with the help of homeopathic medicines. So let's talk about it. So before starting this, first of all, I would like to discuss homeopathy versus drugs, other type of drugs like allopathic drugs during pregnancy. So how homeopathy is much better option. So let's talk about it. Homeopathy. So the medical professionals has diverted the one's choice process of pregnancy and giving birth into a panicked, stressful medical emergency. So due to the high number of lawsuits resulting from medical negligence, doctors are now overprescribing. And great for the doctors, but this new attitude has now brought to light increasing concern over the use of drugs during pregnancy, which the fetus receives too. So it's better to be in the best of health so as not to need these drugs in the first place. Research has shown that drugs during the labor and the delivery can have short as well as long-term effects on infants. So homeopathy before and during pregnancy can help to ensure a drug-free pregnancy and labor. Now let us explore some areas where homeopathy can aid during pregnancy, childbirth and after delivery. So basically in this video, we'll talk about the topics. As you can see here on the screen, these are the basic topics that we will discuss in this video, that is part 1, and the rest of the topics that we will discuss in part 2. So basically in this video, we'll talk about the morning sickness and how homeopathy can help for this problem. And then next we'll talk about the breech presentation. Then thirdly, we'll talk about labor, during labor, after labor, and the stages of the labor. The 3 stages of the labor and how one can manage these 3 stages of labor with the help of homeopathic medicines. So these are the basic topics that we will cover in this video. So let's start. Explore each of these areas one by one. So first of all, we'll talk about the morning sickness and the homeopathic medicines. What are the role of the homeopathic medicines in the morning sickness? So let's talk about it. So there is no need to suffer from the morning sickness, and you have to thanks to homeopathy. The most common remedies for this symptom is sepia and colchium. Make it very clear that morning sickness is not a disease, it's just a symptom. So the most common remedies for the morning sickness are sepia and colchium. So keep in mind that you may not have all the symptoms that go with a particular remedy. Just take the one that matches the best or comes the closer. Use a 30c potency, take 1 dose, 1 to 5 pellets and wait within half an hour. And if so, put the remedy in water and stir vigorously before each additional sip, which you should take only if there is a relapse or a failure to make progress on a single dose. Now let us discuss about some of the homeopathic medicines which are successfully used for the morning sickness. So first medicine, let's talk about the anacardium. Why we will use the anacardium in morning sickness? So anacardium is used for nausea, which is relieved by eating. This is a peculiar symptom. If you face this symptom, then you can use anacardium, that is nausea which is relieved by eating. Second medicine is antimony crude, where tongue is thickly coated and white color and wetter while lying, and patient wetter warm warts, and the patient feel worse from being looked at. So if you have such symptoms, then you can prescribe antimony crude for morning sickness. Now let's talk about the third medicine, that is cocculus. So patient feel worse from the motion, such as riding in the car, chilly, and worse from open air, and worse from loss of sleep, excessive salivation, and much thirst for the cold drinks. So on the basis of these symptoms, you can prescribe cocculars for the morning sickness. Now, fourth medicine for the morning sickness is colchium. So let's talk about the symptoms. So the patient cannot bear the smell or even the thought of food. Worse from riding in a car, and worse from standing up or lying flat. And better flexing knees and bent forward. So on the basis of these symptoms, you can prescribe colchium for the morning sickness. Now let's talk about the next medicine for morning sickness, that is ipecac. So continuous nausea not relieved by vomiting, drooling, tongue is clear and not coated. Patient is thirstless, desire for open air, worse warmth and worse motion. So if you face such symptoms in your patient, then you can prescribe ipecac for morning sickness. Now the next medicine is nux vomica. This is a very suitable medicine for the morning sickness where the nausea in the morning, in bed and vomiting after eating. There is a disposition and which is irritable, angry, constipation, and the patient wakes at 3 a.m. They cannot get back to the sleep and they are highly chilly. Now next medicine for the morning sickness is pulsatilla. So pulsatilla has desire, company and sympathy, beeping, feeling sorry for herself, craves for the fresh air, wants the window open, thirstless, and she has aversion to warm food, tongue coated, white or yellow. So on the basis of these symptoms, you can prescribe pulsatilla for morning sickness. Now the very important medicine for the morning sickness, that is sepia. So let's talk about sepia. When the patient has empty feeling in the stomach which is not relieved by eating. She has a very strong aversion to thought or order of the food. Desire tart food like pickles, vinegar, etc. And she also desires chocolates. She may complain that things taste salty, irritable around people, but does not want to be alone. She feels better from exercise, warmth and sleep. So if you have such type of symptoms in your patient, then you can Symphoricarpus. So Symphoricarpus, the patient is having deathly nausea, continuous retching and vomiting, and she feels better on lying on back, worse from motion and constipated. So on the basis of these symptoms, you can prescribe Symphoricarpus medicine to your patient for the morning sickness if she felt these symptoms. Now next medicine for the morning sickness is Veratrum album. The patient is having vomiting with diarrhea, freezing cold with cold sweats, craves for the cold drinks with the ice, beak and worse from exertion. So these are some mostly used medicines which has been successfully used in case of morning sickness in a pregnant mother. So this was all about the first, that is morning sickness and how homeopathy can help you in morning sickness. Now next is breech presentation and how homeopathy medicines can help you. Let's talk about breech presentation. The most common and the preferred position for the birth of a baby is head first. But a breech position is when the baby is positioned in the womb to be born feet or buttocks first. A breech birth is frequently delivered by cesarean sections, and before 36 weeks it is sometimes possible to turn the baby into a preferred position. So here are some homeopathic medicines which can help you if your baby has breech presentation. These medicines are pulsatilla and natrum muraticum. These are the only two medicines that can help turn the baby around in the womb. So let's talk about these medicines one by one. So first of all, we'll talk about the pulsatilla. So pulsatilla is a very common medicine for this, that is breech presentation, and a treatment of giving multiple doses of pulsatilla 30 Ch potency once a day, no more than 6 doses. Or you can give this in 200 Ch potency, but only once, will often turn the baby. And the women, if needed pulsatilla, may also show evidence of the common pulsatilla mental desires, for the sympathy and company and a craving for a fresh air, and also have a tendency toward the beeping and crying openly. The remedy pulsatilla stimulate the muscles of the womb. So, on the basis of these symptoms, you can prescribe pulsatilla for the breech presentation. Now, second medicine is Natrum muraticum. Let's talk about it. So, Natrum mur has also been indicated as a good remedy to move the fetus out of the breech position and is best indicated when the mother is feeling like she wants to be alone and is worse for company. They are emotional but wants to cry alone. The Natrum muraticum picture is the opposite of the pulsatilla in terms of temperament. Although, having indicated these remedies, the best medicine is usually the one indicated by your local homeopath. So these are based on the uniqueness of each woman's symptoms and should always be the preferred treatment. So these two are the best medicines which are successfully indicated for the women who have breech presentation during their pregnancy. Now next is labor, very important. So how one can manage labor with the help of homeopathic medicines. Now one by one we'll talk about this. Now let's talk about labor and homeopathic medicines. So what happens during a labor? A woman can be treated acutely, and acute prescribing is also of a benefit the baby, such as a dose of arnica 200 ch after the birth of a baby for both the mother and baby, which will ease the trauma and bruising endured during the labor. Now, what are the homeopathic medicines that has to be given in the early labor? So first of all, we'll talk about the early labor and homeopathic medicines. So in case of early labor, when contractions may come and go and the labor is not fully established, so at that time you can give pulsatilla 200 ch and that may help labor start properly. Then after early labor, the second stage, that is established labor. So in case of established labor, the first part of the labor usually can last anywhere from 12 hours in a first pregnancy to 6 hours for a second pregnancy. But no hard and fast rules apply. Uniquely, a woman can be in the first stage for as little time as a few minutes or as long as 36 hours. Homeopathic remedies at this stage can be used to help any natural hold-ups, and shearing the process progresses naturally without the use of allopathic drugs. And that remedy is colophyllum. So colophyllum is given to induce labor or used once when the progress is definitely underway, as it strengthens the contractions. And symptoms that indicate colophyllum include an excitability, restlessness, and nervousness. A woman who trembles internally from weakness, and she is chilly and better for warmth. She will have erratic pains flying about one place to another place, a lack of tone of the uterus, and labor pains that are irregular. The women may experience stiffness in the smaller joints like the fingers, and the mother to be will be exhausted and fretful and will desire company, will not be talkative, spasmodic and the severe pains which flies in all directions, labor pains that are weak, and colophyllum 200 to your patient. Now let's talk about the second stage of the labor and homeopathic medicine. So in the second stage of the labor usually lasts an hour. Yes, we all know that. And so in the first pregnancies and about half an hour the second pregnancy, the stage of contractions become stronger and the women may experience excessive pain. So here what you can do, you can give chamomilla 200. This is a homeopathic medicine, and the chamomilla will help with painful contractions. And the women will be irritable, cross and abusive. She will demand things and then push them away. She will say things like, I can't take this anymore. This is a picture of a woman that is ready to kill the partners for her pregnancy. The pain may be felt as a numbness feeling, with the labor pains pushing down upwards. A chamomile person is thirsty and may have one cheek red and other is pale. This was all about the chamomile medicines. And there are another medicines for the sex. So another medicine is belladonna. So in case of belladonna, what happened? The belladonna pain is described as hot and throbbing, with the labor pains bearing downwards. Belladonna persons are thirstless and both cheeks red. A belladonna persons may be delirious and might hit and bite. And now is another medicine for the second stage of the labor, that is sepia. Sepia is the only medicine which you can use in the whole pregnancy. So let's talk about sepia. Sepia is also worth considering when we are talking about unbearable labor pains. Sepia's pain is described as dull and extend down into the thighs with a wearing down pain, and body will be flushed with heat. She will be chilly and want to be covered. Sepia will be irritated by company, but does not want to be alone. She will be worse from consolation, depressed with the weeping episodes, and then turn and be sarcastic. A sepia woman will be aggravated by the thoughts or the order of the food. And another remedies for the pain during the second stage of the labor are Coffea cruda, Aconitum napellus, Nux vomica, Ignatia amara, Arsenicum album, Calicarb, and Pulsatile. A point to be remembered here that a dose of arnica prior to the birth and immediately afterwards can prevent many delivery problems. The patient needing arnica will feel bruised but will say she is okay and have a fear of being touched. So this was all about the second stage of the labor and how homeopathic medicines are helpful in second stage of the labor. Now let's talk about the third stage of the labor. So in third stage of the labor, once the baby is born, the third stage proceeds and a dose of aconite, that is a homeopathic medicines, should be given to the mother, and the baby will help if fear is predominant. This can be given for the next few days if needed. The final stage takes another 30 minutes or sometimes longer and is marked by an increase in bleeding as a placenta is delivered. And nursing the baby helps detachment of the placenta naturally. So this was all about the third stage of the labor and how homeopathic medicines are helpful in the third stage of the labor. So that's all in this video. We have discussed about how one can manage pregnancy and childbirth easily with the help of homeopathic medicines. So that's all for today. See you guys in our next video, that is part 2. We will talk about pregnancy and childbirth made easier with the help of homeopathic medicines. So basically in that video we'll talk about placenta, retained placenta, postpartum hemorrhage, asphyxia of the newborn, perineal tears and epistomies, and postnatal depression. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy, and yes, thanks for watching this video.